Byers Martin is just 16 years old, enjoying being a high school athlete. But in the summer of 2023,
I was at my 8th grade lacrosse tryout, and I was running with the ball, and I cut and planted and heard a pop.
That pop came with pain.
It hurt. But, a couple hours later, I kind of felt fine as long as I didn't move my knee.
Dr. John Paul Rue at Mercy Medical Center says it was a very significant, complete ACL tear,
including a meniscus tear where the piece had actually flipped forward. So there was some urgency to doing this surgery, even though she was quite a young athlete.
Byers said she had surgery within 10 days, was non-weight bearing for 6 weeks, and then was on crutches for about 2 months after that. Dr. Rue says this injury is 5 times more common in young women.
You could almost call it a pandemic in terms of ACL injuries in our young female athletes. And I do think there is something to be said about being well-rounded and doing different sports year-round instead of one sport all year round, because it is the repetitive, cumulative trauma risk for that particular injury.
Experts say part of the reason young women are more prone to this injury may have to do with females being more knock-kneed, as well as women usually having less muscle mass around the knee to support it than men. Puberty is also part of the equation. Studies show hormones fluctuate during that time, suggesting high levels of estrogen may increase the risk. Dr. Rue says prevention is key.
Increasing the strengthening of certain muscles, increasing the ability to be flexible, working on the way that a young athlete might jump and land.
Byers said she did exactly that. And now, more than 2 years later, she's back in action and dreaming big.
Obviously, you never want it to happen to you, but I'm kind of on the outlook that, it helped me get stronger, and where I am today, I don't think I would have been had I not done it.
Dr. Rue says young women like Byers are at a high risk for recurrent injury, as well as at very significant risk of tearing the other knee's ACL, so following through with rehab is extremely important.